dry needling. Um, what is dry needling?
So, in the most simple terms, dry needling is taking a small, thin needle, inserting it into your muscle, and creating a change, reducing pain or creating a mechanical change.
Does every PT use dry needling?
No, so dry needling isn't a part of your license right out of school. You're exposed to it in the program, and then it's additional certifications after. So there's different courses. I use the Institute of Clinical Excellence, the ICE Physio courses. They were great, but there's other programs and thought processes out there.
ICE is good. They have good Instagram content, good information and stuff.
They produce a lot of great information across the board.
Yes. So how does dry needling work?
So basically, what I'm doing is I'm taking the needle. It's a thin, solid needle. It's not a hypodermic needle that you would get an injection with. I'm taking the needle and I'm inserting it into the muscle and I'm stimulating the muscle spindle. And from there, I'm creating an afferent response. And that's going to go into your spinal cord. Those signals are going to go into your spinal cord. It's going to stimulate this interneuron pull in there, and it's going to create a response back. So creating a muscle twitch at that level. It's also going to create a change on up into your spinal cord, into your brain. So your brain has a somatosensory cortex, a homunculus. That's your body's map on your brain. So all of your information, motor, sensory, all of that is there. And when you experience pain, those borders of each body region that's affected become diffuse. So with needling, we're able to sharpen those borders a little bit and help reduce pain and that kind of stuff.
Cool. So it's certainly more than just putting needles in your muscles and it makes your muscles feel better. There's
a lot of science to it that, I mean, it's very in depth and the research is just growing and growing.
Cool. So is dry needling just for pain?
Not at all. So with dry needling, obviously pain relief, but also neuromuscular changes. So improving your muscles, strength, coordination, reactivity, that kind of stuff. And then also I'll utilize it for recovery or like fluid movement, reducing edema and that kind of stuff.
Very cool. So with dry needling there, I guess what's the difference between dry needling and acupuncture?
Well, I'm not trained in acupuncture, so I can't say 100%.
Right.
But traditionally, most people know acupuncture is based on like an Eastern medicine approach versus dry needling is a Western medicine approach. Acupuncture, if you look up what they say they treat, pain is part of it, but they also list other things like fertility, digestion, I think like migraines and that kind of stuff. And that's not anything that dry needling touches. We are strictly creating changes at the muscle level for pain and motor control and all of that stuff.
Very good. So that makes sense. If I'm going to go into a session with you and we're going to do dry needling, like what can I expect? Like what is that going to look like?
So for me, it's only going to be after a full assessment. So we're going to do the full evaluation. And dry needling is only a tool. So if it's not a great fit for you, don't feel pressured to have dry needling. I'm going to do a thorough assessment, and then we're going to determine what muscles we want to target because I'm very specific with it, right? So if you have low back pain, I'm going to target the lumbar multifidus and like the maybe QL, maybe hip, just the areas that are impacting your deficits and causing your pain. So we're going to position based on the muscle that I'm targeting. So your positioning may be in sitting, you can be laying down on your stomach or your back. Just, I want you to be comfortable and I want to have effective and safe access to that muscle. And then when I get the needles out, first we're going to sterilize the area with alcohol swabs. And then when I get the needle out, I'm going to show it to you. It's just a thin little needle in a guide tube. And so what we'll do is I will apply pressure with my fingers. So I'm trying to take up the skin and subcutaneous tissue layers to get a firm pressure on the muscle that I'm targeting, or the muscle level that I'm targeting. And then I'm going to take the guide tube and I'm going to put a firm pressure with the guide tube. So hopefully between my finger pressure and the pressure of the guide tube, you're not actually going to feel much of the prick of the needle. Hopefully you might feel some, which is, part of it, but there's going to be a lot of pressure from my fingers in the guide tube. So people don't think like it's a shot because it's not a big needle. It's not a big prick like that.
Right.
But what you will feel is when I insert the needle and I'm starting to push it into the muscle level, it's going to create a twitch response. So the muscle is going to grab, and people might not love that. But that's what is probably going to be the most shocking for first time needlers.
Okay. And I understand that you use stim.
Yes. So I use electrical stimulus with the needles. It basically helps enhance the effects of the needling. So when you put the needle in, I might piston a little bit. That's one method of creating that muscle twitch. But with that, the more pistoning I do, the more sore you will be, research shows. So we can actually use the e-stim, one, to verify that I have the right muscle and I'm at the level that I want to be to get a good response from those muscle spindles. And then I can create the changes in the muscle pumping without sitting there pistoning over and over. And so it's going to be more comfortable in the long term, and you're going to be less sore in the long term. And so the e-stim is what I'm going to utilize to create the changes versus when I'm talking about pain reduction versus fluid movement versus neuromuscular. So I'm going to change the settings on the e-stim machine, and then like time and duration and that kind of stuff to target the different methods.
And then whenever you are in a session, do you do dry needling alone, like by itself?
No, so I don't. I think some people do, but for me, when I do the needling, I'm creating a window of change. So I want to utilize that. So we have reduced pain. We have improved neuromuscular activation. So I want to go into the gym and I want to follow it with a modality, a treatment. Typically, I'm going to use therapeutic exercise. That's my go-to. I am a strong believer in improving strength mobility will help reduce pain. So I'm going to use a targeted exercise to really get the most benefit out of the needling that we just did.
Cool. And then, so I heard you say that soreness could be a thing.
Yes. You're probably going to be sore. Hopefully not super sore, but we are creating muscle contractions, and then we are going to follow that with exercise. So it's like anything, you should be expected to be sore for a little bit. Hopefully it's not extreme. And, it's a conversation to be had, constant feedback to mitigate that.
Cool. So I think that's helpful. And then if there is someone who has been questioning dry needling, but maybe they're nervous or they don't know what to ask or say, what would you say to them?
Yeah, I would say just to try it. Come ask your questions. I'll show you, demonstrate to you, give you all the information that I can. But it's a great tool. It's a great tool for someone who's in acute pain and chronic pain. There's a lot of improvements to be had utilizing it. But again, it is just a tool in our toolbox. So if you're someone who's afraid of needling or it's contraindicated for you, then don't think that's the only thing that we have to offer.